Hi, my name is Dr. Courtney Day. I'm a naturopathic doctor from Portland, Oregon. First of all, I just want to say thank you for inviting me to the Charles E. Holman Foundation. It's a pleasure and an honor to be here. The name of my talk is Unraveling Complex Cases, Treatment Approach to Polymicrobial Infections in Patients with Morgellons Disease, and Evidence of Vector Diversity. So I just wanted to go over my diagnostic approach that I use when meeting a patient that I suspect has Morgellons disease, using an evidence-based functional medicine approach. So the first thing I do when I sit down with a patient is I really focus on gathering their medical history. You can learn a lot just from a patient's story and really sitting down and taking the time to examine them. So I really try to follow the progression of their physical symptoms, gather their exposure history, their family history, their pet health history. I find that a lot of my patients actually have other family members who have had similar symptoms or maybe even have Morgellons disease themselves. Doing a complete physical examination and a dermatoscopic exam is very helpful to do the clinical diagnosis, but then I always try to back that up with labs and diagnostic work as well. So I assess for psychiatric symptoms as well as a history of physical or emotional trauma. I find that a lot of our patients have some sort of story that goes back to childhood even, adverse childhood experiences or PTSD that really allow the immune system to become more susceptible to certain polymicrobial infections. And then also just understanding their socioeconomic status, insurance status, social and family support, because that really determines how I can really work with a patient and what I'm able to do for them. Unfortunately, sometimes. It's to the point where the patient has such little support that it's really hard to even establish them as a patient and really help them as a doctor, just knowing that they won't be able to be compliant. So Mary Ann did a great job of going through you know, some of the manifestations that we see with patients with Morgellons disease and explaining why that's developing in the body. But here's some pictures of some things that I've seen in my office using just regular physical exam or dermatoscopic exams. But I really go beyond that and try to assess for what could be underlying in this patient's immune system that's allowing them to start presenting with something like Morgellons disease. So I test for the bacterial infections, and we've gone over which ones are associated. But I'll also look at other just bacterial infections, fungal, viral infections based on the patient's case. And then I also assess for environmental exposures and toxins. Evaluate their organ system functions, their immune function, test for autoimmunity, and screen for other nutritional or mineral deficiencies, consider allergies, sensitivities, and then genetic analysis as well sometimes comes into my diagnostic approach. I find that assessing environmental exposure can be a really important part, especially understanding a timeline and where possibly they could have gotten some of these infections or toxicities. Biotoxin illness and chronic inflammatory response syndrome is something that I'm always screening for as well, and often plays a part in a patient when they have been sick for years and have not able to get better. So here's Dr. Horowitz's screening questionnaire that I'll often use for when I suspect a patient has had Lyme disease exposure or symptoms of Lyme disease. And then evaluating organ systems, there's a whole bunch of different laboratory labs we can get into when it comes to assessing thyroid function, adrenal function. A lot of our organ system functions can sometimes be affected when you have chronic illness, as well as immune function. So I just listed some of the various labs that I'll run on patients, as well as screening for autoimmunity. There's various nutritional and mineral assessments that can be done, and often just addressing some of these mineral deficiencies and vitamin deficiencies can really help a patient to improve. I'll assess for heavy metals and other toxicities, mycotoxins and mold. Particularly, I find the ERMI test and environmental assessment to be very helpful to make sure that a patient isn't in current exposure. And then we can also do a nasal culture to test for a particular type of staph bacteria that can colonize in the sinuses after mold or mycotoxin exposures, which I have seen just clearing that be very helpful for helping patients to improve in their symptoms, because that particular type of staph can make biotoxins that also affect the immune system, and I'll talk about that in just a little bit. And now we have the ability to do urine mycotoxin testing for pretty affordable prices, so that's another way to assess to see if a patient has been exposed to mycotoxins. Here's the ERMI test that I mentioned that you can do on a home or a building to compare it to the rest of the buildings in America. And here's some of the symptoms that Dr. Shoemaker has listed as part of his analysis of biotoxin illness. So I'll often go over these symptom clusters with patients to see if they perhaps match that and do further testing. One way that mycotoxins can affect the body is to cause more electromagnetic sensitivity, and I do see this in some of my patients. So that will be one of the red flags that will make me think of doing more assessment in that area. Also, a big part of my practice is the testing for the bacterial, fungal, parasitic, viral infections that are involved. Recently, I've been diagnosing several patients with different Borrelia strains, not necessarily Borrelia burgdorferi, but Borrelia recurrentis and some relapsing fever strains that are known to spread through other vectors besides ticks, so that's important to keep in mind. I was lucky enough to have a retired parasitologist volunteer his time one time to help me confirm a case of body louse in a patient. And he was quick to bring to my attention that I need to be testing for the relapsing fever strains, and that patient did actually end up testing positive for one of the relapsing fever strains and responded really well to treatment. Dr. Klinghardt has published in the American Journal of Immunology a way to use something called autonomic response testing along with provoked PCR urine testing as a way to help diagnose patients. And I do find this to be a useful tool in practice, especially early on when some of our serological tests aren't as reliable. And I have a case of a patient who tested with the PCR test as coming back with Borrelia burgdorferi, nonspecific antigen, Borrelia recurrentis, nonspecific antigen or amplification, and then a Bartonella Hensley strain. And just recently, we finally got a CDC positive IgG Western blot on this patient coming back from medical diagnostics laboratory, and they're a laboratory back east. So it's kind of nice, I think it's a way to try to screen for some of these infections that we can't reliably test for early on. But I always like to confirm with serology as well in these cases. And so this was a Morgellons patient whose results I just showed. And then we do have papers showing that there's an immune response and prolonged exposure to Lyme disease that can lead to more persistent cognitive defects. So I do see quite a bit of cognitive dysfunction in my patients that have a long history of symptoms. So I'm always thinking about Lyme as causing perhaps those defects as well as toxicities. I like the stool analysis, PCR analysis as well on stool to try to test for pathogens and parasites. This is a very sensitive test, so I'll often repeat it with other stool testing when I see that there's a positive result. But this is one way to do a very sensitive test for things like C. diff, H. pylori, and then also assess just the pathogens that are present as far as dysbiosis, fungi, yeast, viruses, and parasites. I do find that quite a lot of my Morgellons patients come back with some protozoal parasites, but I don't typically see very many worms come back, at least on this GI map report. And then I always assess for Epstein-Barr virus kinetics as well. And Marianne mentioned how EBV can be connected to some of the skin presentations and can be more common in patients that have immune problems and chronic infections. So I also consider allergies and sensitivities in my patients. I find that quite a lot of my patients have gluten sensitivities or reactions. So I'll screen for celiac disease and non-celiac gluten sensitivity, as well as other food or inhalant allergies and sensitivities. The Clifford testing could be a nice tool too for dental and surgical compatibility. So here's an example of my Clifford test, for example. It tells which components would be reactive and good to avoid when you get any dental or surgical work done. I mentioned before the autonomic response testing is a tool I use in my practice. That can be used to also assess for allergies. This is a publication showing the autonomic response testing results compared to IgE allergy panels. I also will assess for joint hypermobility and Ehlers-Danlos syndrome. That can be a part of Lyme disease as well as Bartonella is what they're finding. There was a publication on a rheumatological presentation of Bartonella. I think this was a veterinary doctor that saw improvement following treatment for Bartonella in joint hypermobility that was mimicking Ehlers-Danlos type 3. And Bartonella can be a very tricky infection to diagnose. Often the antibodies will become positive during or after treatment. So this is a graph of how that can happen when the antibiotics are started. So sometimes we don't confirm the Bartonella it was present until after we've done treatment. And Bartonella can cause, after it causes infection in a patient, it can cause ongoing inflammation, just how it affects the collagen vascular system. So here's just a diagram of how you can acquire Bartonella from a blood-sucking arthropod, but then the symptoms that you develop later on can mimic any collagen vascular disease. So that can include muscle and joint pain, peripheral neuropathy, migratory neuropathy, muscle fasciculations, headaches, fatigue, decreased stamina, and it's also associated with dysautonomia or postural orthostatic tachycardia syndrome. Here's some clinical signs of Bartonella in a Morgellons patient of mine. And the principles of antimicrobial therapy for Lyme or Bartonella, and this is what I follow in my practice, is usually a long duration of treatment. So the studies are pointing to a length of usually 6 months or more that it takes to resolve Bartonella infections. Conventional antibiotic approaches don't really seem to work, at least those that are published in literature for short-term antibiotic courses. Oral antibiotics are preferred. This is specifically talking about Bartonella treatment. Intracellular versus extracellular permeation is to be considered when we're doing treatment. The different antibiotics that we use have different permeation within the body, and Bartonella, for example, is an intracellular infection, so it needs intracellular antibiotics. Some of our antibiotics are bacteriostatic versus some are bactericidal, so these are all things you can take into consideration when doing treatment. Also, they all will affect the Cytochrome P450 in different ways, so you have to know when you combine treatments, what combinations or how they're affecting the body together. And then we also have this idea that there is resistance or persistence that can happen when we're doing treatment. And then these treatments are all affecting the body and the adrenal function as well, so that can be something that can cause some of the reactions to treatment alone can just be because of the treatments that we're giving the patient rather than the actual infection. So complications of Bartonella treatment, not all patients can really even comply with treatment because of the Herxheimer reactions and reactions that can happen when we're doing treatment. Sometimes when a patient can't go through typical treatments, I'll try to step back, ask why. There's different reasons. Sometimes genetic analysis can be useful. Certain patients have either SNPs or human leukocyte antigens that we can test for that will give them an inherited susceptibility to developing chronic inflammatory responses to various biological toxins, and can also help us determine the patients that are likely to be more sensitive to treatment. So Dr. Ben Lynch is a naturopathic doctor who wrote a book called Dirty Genes that can help with understanding how genetic SNPs can affect detoxification pathways, for example. And then in my practice, I look at HLA genetics as well, and haplotypes. There are certain haplotypes that make a patient more susceptible to mold or Lyme disease or dinoflagellates as toxic algae blooms. And then you can see that there's a Marcon susceptible haplotype as well. That's that staph that I had mentioned that can colonize in the nose. And so here's a pathway, a diagram that Dr. Shoemaker had put together, just trying to explain how certain patients, especially the ones that are more genetically sensitive, can develop a chronic inflammatory response after being exposed to things like mold toxins or Lyme disease. So often I'll use this as a diagram in my practice to not only assess a patient, but also to try to explain to them why they're not feeling better yet or how we can get them feeling better with treatment. And it's important, I try to explain to my patients too about how our physiology works in the body, that a lot of the treatments that we're doing rely on the liver and the gallbladder to process toxins and remove them from the body. Our body bile is really expensive for our body to make, so we tend to recycle most of our bile. About 95% gets recycled as it travels down the small intestine. So often I'll use treatments that can interrupt the recirculation of bile, like natural biotoxin binding agents or bile acid sequestrants to help remove the toxins as we do treatment. And then also just promote bowel movements is really important as well, just so we can eliminate toxins. Low-dose naltrexone is one treatment that can really be really helpful for patients, not only as a prokinetic, but also as an immune modulating agent. And in naturopathic medicine, we have 6 primary tenets that we follow. So when I'm approaching a patient, I always try to keep these in mind, that most of all, we have the ability of healing. There's a healing power of nature, that our bodies have the ability to, when given the right circumstances, to heal ourselves. So I really do try to help promote that and promote the vital force within the body. We try to identify and treat the causes. I think I talked a lot about that. I think I do that, really start digging further than a lot of doctors do, trying to find what could be the underlying causes. First, do no harm. Really trying to make sure that whatever treatments I use will benefit the patient and not cause harm. And then really use my time with the patient not only to give them the medications that I think they need, but really teach them how they got sick, why I think they got sick, how to prevent getting sick in the future, and help them to teach others how to recognize things like tick-borne diseases so that they can get the treatment that they need. Also, treat the whole person rather than just the diseases. I try to make sure that I treat every person as an individual. That's why I can't just tell you a exact treatment approach. It's all individualized. And then focusing on prevention. So for treatments in my practice, I'll use the conventional antibiotics, and I listed some here. Antiprotozoals can be very helpful as well. And then antimalarials, especially if a patient has a co-infection of babesiosis, that's really when I'll be using the antimalarial drugs. I do find that quite a lot of patients will benefit from antiparasitics. Some of these patients were able to identify parasites, but most of these patients were not able to actually confirm any parasite infection. And then antifungals, I think are important, especially if we're doing long-term antibiotics to prevent any further fungal overgrowth. And antivirals can be very helpful and useful as well. And here is a paper by Dr. Stricker, who talks about how long-term antibiotic therapy can improve persistent symptoms associated with Lyme disease. Because you'll see there's conflicting literature at the moment, but in my practice I do agree with this, that the long-term antibiotic therapy it improves most of my patients. Drug combinations can be very important, and this paper focusing on drug combinations that can be used to help with the round bodies and persister forms of Lyme. So I hope that there's more development that happens in this area so we can have better treatment approaches in the future. And then using some of the natural and herbal treatments can be very helpful in combination or even alone. Some of my patients are so sensitive that they can't really tolerate antibiotics, so a lot of times I'll turn to the herbal antimicrobials and natural antimicrobials. I find ozone therapy to be very helpful to making the treatments be more effective or just get to symptomatic relief faster. And there has been publication on various phytochemicals and micronutrients and their effect on Borrelia burgdorferi. So here's a paper that just summarizes some of the natural plant extracts and the micronutrients. And you can find all of this on PubMed. Artemisia annua is a herb that has won the Nobel Prize for its use as an antiparasitic worldwide. It is also, its mechanisms are very much dependent on pH and oxygen and oxidation in the body. So this is a paper that just explains the mechanisms, but I do find that to be a very helpful herb for many of my patients. Either the whole herb, or you can also use artemisinin or some of the derivatives. And then anti-inflammatory herbs, I think, are very helpful as well. This paper focuses on coptis, which is a Chinese herb that I found to be quite helpful for many of my patients. And then just focusing on a holistic treatment approach. The doctor that I work with, and my practice doctor, Werner Vosloo, he has formulated formulas called Return Healthy, that focus on a foundational formula, herbal formula to promote microbiome balance within the body, an adaptogen formula, a formula that's focused more on anti-inflammatory action, as well as some combination natural biotoxin binding and reducing agents. So this is something that I'll use for a majority of my patients in conjunction with other treatments. And then biofilm treatments can be very important. There are different strengths of biofilm treatments, and so this is a diagram to help kind of understand the differences between early biofilm phase 1 type treatments and later biofilm phase 2 type treatments. So phase 1 I think of more of as prevention, ways to inhibit biofilm formation in the body, and phase 2 biofilm treatments I think of more as disrupting the biofilms in the body, and so I want to make sure that if we're going to use phase 2 biofilm treatments that we have other treatments on board, and usually I don't do that right away first thing with a patient. So here's an example of different prevention versus active biofilm therapies that I'll use in practice. The ones on the left are more prevention, the ones on the right are more active treatments. And then this paper focuses on stevia as a biofilm agent that I find can be very helpful for biofilms in the gut and prevention of biofilms. And then this is a formula I'll use from Imprimis. They're a compounding pharmacy that they can make this particular DMPS formula for biofilm treatment. They also have a DMSA version as well. And then topical treatments can be very helpful just to prevent the, like Evie or Sapi had mentioned in her paper, and Marianne Middleveen, that there's some biofilm formation that can happen, perhaps even on the skin. So some of these soaps and cleansers and topical disinfectants can really help with that biofilm. And then other topical treatments, baths, soaks, and I listed some mouthwashes that patients have found to be very helpful. I do find that a lot of patients have irritation in their mouth and their mucosa in the mouth, and so that can be one area that if doctors aren't really looking, that can be missed and neglected. So always remember to look in the mouth. And then just some topical treatments to really help with the itching and healing. I find that if patients can stop scratching themselves, itching, then they can heal a lot faster. So recently, I don't know why it took me so long to figure this out, but hydrocolloid Band-Aids can be very, very helpful because they're not as irritating. So patients tend not to itch themselves, and they can cover the wounds really well, and they help promote healing. And also neural therapy is something that I do in my practice, which you can use ozone as an intradermal agent. And I find that to be very helpful in healing non-healing or slow healing lesions. And then I always think too of hyperbaric oxygen therapy. That's thought to be the chronic wound healer. I won't use that right away with patients. I usually wait till they have already started making some improvements. But I find that that can also be very helpful to speed up healing. And then I mentioned earlier that low-dose naltrexone can be used as a prokinetic in the gut, but also a immune modulating agent. So that's sometimes something I'll use, especially if a patient is showing signs of autoimmune disease. Cimetidine or antihistamines are another thing that we can use. This is a paper that shows cimetidine as a novel adjunctive treatment for early stage Lyme disease. And there's a lot of research going on about mast cells and mast cell activation and histamine as driving a lot of the symptoms of, or chronic symptoms in Lyme disease. So I do find that doing treatments that stabilize mast cells can really help. And then more recently in my practice, I've been focusing on the vagus nerve connection. The vagus nerve is extremely important to our autonomic nervous system. It's in control of our parasympathetic responses in the body. And I find that if we can do strengthening exercises and work on the vagus nerve, that often patients will start to feel better on not only a physical level, but just feeling more grounded, less mental, emotional symptoms as well. So some of the vagus nerve exercises that you can do involve things like gargling and gagging, which are not quite as fun as singing, in my opinion, so that's what I prefer. Coffee enemas can also be one way to strengthen the vagus nerve. And I've been using transcutaneous vagus nerve stimulation in my practice as well as a way to strengthen the autonomic nervous system. This is Dr. Nemechek's approach to that. And he was actually able to show reversal of moderately advanced Alzheimer's disease dementia within 5 months of starting this protocol, which I think is amazing. And then here's a whole outline of his protocol. And then also shows, there's studies showing that the transcutaneous vagus nerve stimulation can even enhance creativity and divergent thinking in people that are not even sick or just normal everyday people. So I think that this is, for anyone, can be a really good strategy for maintaining our health long term. And my personal way of doing this, personally and in my practice right now, I really like this device called Nirvana. It's available on the website called experiencenirvana.com. It was developed by an anesthesiologist who wanted to use less anesthetics in his practice, and so he uses this as a way to promote sleep in his patients before they go through surgical procedures. So it's advertised as just a way to enhance your nirvana to when you listen to music, but you can use it with or without music as a way to strengthen and signal the vagus nerve electronically. So that's all I have to share with you today. I wanted to open up the floor, though, to any questions.
Where are you located at?
I'm in Milwaukee, Oregon, which is right next to Portland, Oregon. Yeah. Okay, so the hyperbaric oxygen therapy is a therapy that uses a chamber that has high amounts of oxygen and changes in pressure. So it mimics what you would get when you go scuba diving. So it mimics the depths of going under the sea. And when you combine oxygen and pressure together, It can work as a therapy that's been approved for certain conditions in the United States. A lot of times it's stroke victims that they'll use this for as a way to improve cognitive therapies with patients, but it's being used off-label or without insurance approval for other conditions, including chronic wounds, and that's part of the reason why I started using it in my practice was thinking of it as a chronic wound healer. But really, it has a whole bunch of benefits to the body. So we're seeing patients report better sleep, better mood, better cognition, all sorts of things. Joint pain. Yeah, it really depends on the patient. Every therapy is different for everyone, and it depends on their underlying conditions, but we are seeing improvement with that therapy. And then the neural therapy that I mentioned, neural therapy is a therapy that comes out of Germany, and it can be used for different things, all different things. There's all different particular protocols to address organ system dysfunctions, nervous system dysfunction, but really how I was talking about using it in my practice was for helping to heal chronic wounds when you use it in conjunction with ozone, as well as scar therapy. So neural therapy, all it is using an anesthetic called procaine usually, or any anesthetic, to anesthetize an area to disrupt energetic disturbances or scars is what the thought is or hypothesis is. But when you combine it with ozone, you can actually promote further healing in the body, and ozone has antimicrobial properties, so it tends to work really well in places where the immune system just can't, or the blood vessels just can't get to it normally, where there's a lot of scar tissue or areas that there's not a lot of blood flow to get to for healing.